that's why we came here. If we were going to leave, we'd have left many times by now. And my wife.
Now, the board did not comment on the amount of a raise that would be offered. A breakdown in talks today between the United Auto Workers Union and Chrysler has led to a nationwide walkout. Thousands of union workers left the job for the picket line this morning. Jay Gray reports from one of those affected plants in Warren, Michigan.
Just before lunch, thousands of United Auto Workers across the country took what could be an extended break from work.
They're expecting the strike to go a little longer, and that would be necessary for the union to get the leverage that they need to get the deal that they want.
The breakdown in negotiations between the union and Chrysler seems to center on how much the automaker will contribute to a UAW-run trust fund that would pay for an estimated $18 billion in retiree health costs.
Our parents and other people, retirees, fought for what we have, so we think that if that's what needs to be done, that's what needs to be done.
The union is also pushing for a promise from Chrysler to maintain the current level of U.S. jobs instead of contracting overseas.
Our kids, the next generation, aren't going to have jobs. So that's what we're doing. We're going to try to keep these jobs in America.
The current walkout comes on the heels of a two-day UAW strike of General Motors. The two sides agreed to a tentative deal in late September. But this Chrysler situation is much different. Under new management and with a huge inventory already in place at dealers across the country, analysts say it would take at least a month for the work stoppage to affect sales.
We'll be out here as long as it takes. We can hold out just like they can.
Leading many to believe these striking workers could be in for a long walk. The union and Chrysler are continuing their talks, but at this point, neither side is suggesting they're anywhere close to any kind of a deal. In Warren, Michigan, Jay Gray, NBC News.
Well, it appears a Bullitt County Youth Football League will not be in the dark much longer. Somebody ripped out and stole the coveted copper wiring from light poles on the Cedar Grove Vikings practice field. Now more than 200 young athletes can't practice after dark. But since our story aired at 11 o'clock last night about this, several companies have come forward offering to donate the materials and the manpower to turn the lights back on. The team had spent the majority of their season raising money for these new lights, and they were just installed 3 weeks before somebody stole the wiring. Well, as Congress debates whether to expand health insurance for low-income children, a report in tomorrow's New England Journal of Medicine finds that kids who can afford a doctor still aren't getting the care they need. Tracy Potts has more.
This Washington, D.C. clinic measures and weighs children at every visit.
So that really helps us to keep track of which of our patients are trending towards obesity.
But the Rand Corporation found almost 70% of preschoolers they studied never saw a scale.
How can I possibly know that a young infant isn't gaining enough weight?
Rand reports less than half the kids they studied got the basic care experts recommend. And these were mostly middle-class white children with private insurance.
We just want to make sure that people don't assume that if you can get in the door, the right things are going to happen.
More findings. Almost 2/3 of children weren't checked for anemia. More than half with asthma weren't prescribed proper medicines. More than half of teen girls weren't screened for chlamydia, and only 1 in 6 kids with high fevers were checked for common urinary tract infections. Researchers blame insurance companies paying doctors to see more patients in less time.
We should be able to bill at a higher level if I spend 15 minutes educating a parent about asthma. And right now, I can't do that.
And they note medical schools spend more time teaching sick care than prevention. But pediatricians point out many kids see more than one doctor, and that means things can be overlooked.
Particularly if a child has a chronic problem or has a problem that requires being seen by multiple physicians, you need a quarterback. You need somebody who coordinates the care.
Rand recommends changing how doctors are paid, focusing on quality rather than the number of patients they see in a day. The children's health insurance bill that President Bush vetoed included millions of dollars to improve the quality of health care. The House will try to override that veto next week. Tracy Potts, NBC News, Washington.
Well, the federal government says more needs to be done about the growing numbers of recalls. We've got that story next. And speaking of recalls, troubleshooter Charlie Young has another recall to tell you about, this time involving kids' plastic cups. And in Health Alert, a Louisville doctor is now able to test patients to determine who may be more at risk for breast cancer. Now here's a look at those local high and low gas prices.